Hey everyone, since I finished my final exam for my ICC clerkship, I'm just reflecting on kind of what resources really helped me study, excel in the clinical environment, and also make sure I can pass my exams. I thought I'd do a video kind of talking about my top 5 study resources. A really important point when looking for study resources isn't your first 2 years you really want to amass a wealth of knowledge and you just have all this knowledge, but it's not very usable and organized. So all of third year clerkship is helping to reinforce what you learned and maybe you forgot from your first 2 years and organizing those file cabinets. Because you think your first 2 years you're just dumping information into the file cabinets, but it's totally all over the place. And your third year is refining that information, learning about the diagnosis and management, and then organize that information. So you start having approaches. You're not just regurgitating information and you're integrating understanding knowledge. So I'm going to talk about the top 5 resources. My number 1 is the New England Journal of Medicine's clinical video series. Absolutely amazing, because if you think about the most important thing you want to get from your clinical clerkship is the practical experience, because you're going from medicine being theoretical to practical in your third year medicine. You want to get in there, do your intravenous's, do your intubations, do as many procedures that you can. And what I love about these New England Journal of Clinical Medicine videos is they not only go over the correct technique, which is important, but if you really break down like procedures, yes, they can be really scary and they're difficult. But once you get the mechanics down, they're relatively simple procedures. The hard part is understanding the anatomy, the mechanisms, the indications, and contraindications. And having a good theoretical base is so important, even for something as simple as intravenous, but especially as important for something like paracentesis. Now, if I'm ever going to do a new procedure or I watch the procedure, I'll definitely come back to these videos. And when I'm troubleshooting, I know initially IV access came to me relatively easy, but now I was having some troubleshooting, some difficult things. Going back to those videos, understanding the theory about the needle, the catheter, etc., what to do, helps you make good decisions, understand certain rules, such as when you hit a vein and you see blood, why you can't change your direction from then. Or when you're intubating, different important things you have to consider. And it's not just important to know how to do the thing, but it's how to know when you should do it, and most important, when you shouldn't do it. And that's really what all the surgeons kind of universally said. The great surgeon isn't the one that's great at cutting, but it's knowing when not to cut. Second resource, I've done already a review on it, is Osmosis. It's amazing. Check my review. If you don't want to pay and you want it free, they have excellent videos, which for the most thing could be good enough. But if you want the extra boost, definitely check out the Osmosis Prime. Number 3, the American Family Physician Association has excellent articles on certain specific clinical topics. And what I love about them versus a lot of other resources isn't just regurgitation of information, but it's about a practical approach for family physicians. And I think it's a very good level. I mean, some of it's a bit too advanced for medical students, but reading the specialty guidelines can be helpful and interesting, but I find it's way above our level as a medical student, and you kind of get lost in the details, because the goal of medical school is to become a well-rounded, differentiated physician, and those articles do a great job of taking the information you know and organizing, which is the name of the game of your third year clerkship. Fourth resource, which has been so helpful for pediatrics, which is kind of a weakness of mine, is these Acquifer case series that are provided through us through UBC, and the ones for pediatrics were absolute lifesaver for the final exam I had. And what I love about it is you go through a very kind of involved clinical case multiple times, followed with a patient, and they go through very realistic case samples. They give you lots of good opportunities to practice your differential, give you a lot of tidbits, and you're learning it in the context of a case, which as a whole case-based learning is so helpful. And what I really like to is they have questions at the end, good case summaries, and they also give you opportunities throughout the case to kind of summarize, which is a really important skill to have. Because it's not just about can you do a good history and physical, but can you succinctly communicate that to your preceptor or attending. And the last resource I'd like to talk about today is Paul Bolin's YouTube videos. He's a really cool internist. There's these excellent videos on wide-ranging topics. I absolutely love his videos. They are a bit detailed. He does go a bit slow, but on YouTube you can increase the speed, and he kind of just says for the most part what's on his slides. Sometimes he adds tidbits, so you may not want to skip things, but you can kind of just read the slides and go through it. And they're absolutely excellent, very systemic approach. And what I love is he have these long videos, but it'll go over, like, for example, dysmenorrhea or abnormal uterine bleeding, and it'll have a video on that, and I'll kind of go through the differential, what distinguishes each from the other. So that is super helpful, again, because it's about the clinical approach. Yes, you want to know all the knowledge. It's really important not just to memorize information in just pieces, but understand the approach, why you think one versus the other, logically, why that makes sense. And lastly, you may know most of these resources, actually all of them are all online. So for any of you who are a bit more old school, a bonus resource, which is actually a textbook, a book I come to a lot, especially initially when I'm starting, is the Lange case file series. I find it very good. It's a bit brief for my liking, so it's not your end resource, But I think especially for medical students, it's really important to have a really good launching pad resource where you can kind of get a map of what the topic is. So let's say you're doing asthma. That's such a big topic. You can do a respirology residency and then a 2-year fellowship just in like pediatric asthma or asthma in general. Right? You can really delve deep in the topic. And yes, it's fascinating. Part of my academic, inner academic wants to just delve into that research. But your time is limited. It's really important to remember the goal of what your training is and your level of training, what you're expected to know. So it's great to have a good resource, and whatever you choose your resource to be, one allows you to get a good picture so that you know what the key points are, and then if you need to delve more into it as a family doc or whenever, or if you are going to specialty, you know how to do that. So I really hope you enjoyed this video. It really gave you a good overview of some really good resources to help you in your clerkship, because the name of the game of clerkship is practical application of skills and interventions and being able to organize information into a organized and coherent approach. So those resources are: 1, the New England Journal of Videos in Clinical Medicine; 2, Osmosis; 3, the American Family Physician Association articles on various clinical topics; 4, Paul Bolin's excellent YouTube series and Acquifer case series; and the bonus one, if you're a bit old school, you like textbooks like me, is Lange's case file series. So I really hope you enjoyed the video. If you did, please give it a big thumbs up and make sure to subscribe for more awesome videos. Talk to you soon.